Welcome to Talking Heads on USA Global TV, starring the one and only wonderful Dr. Jacalyn. It's a prestigious place where world-class influencers and experts meet, and where you'll find the most trusted advisors and coaches for all things in life and business. Visit usaglobaltv.com to sign up for our newsletter, get the value you need, and be first in line to learn about events and giveaways and other valuable content. Connect with us. Email Dr. Jacalyn at usaglobaltv.com to talk about how you can become part of USA Global TV. That's USA Global TV, where the doctor is always in.
Hello, everyone, and welcome to USA Global TV and Radio. I'm Dr. Jacalyn Kerbeck. I'm the president, founder, and chief listening officer here at our network. We are 29 live broadcasts strong each and every week, and we thank you for your loyalty and for your follows and views. Our show today is Aging Gracefully with Humor. And today we're going to be talking about connecting patients with healthcare providers. And our guests today are coming back to see us again. It's such a popular and interesting topic and relevant to so many. So we're very excited to have them back on the show. Before we bring out our guests, I'm going to bring out the star of our show, CATHY FULTON, whom you probably know as an interior designer, interior decorator. She's been changing the lives of so many. And she also has her own home healthcare business. Let's welcome her to the show. Hi, CATHY.
Hey, good morning. How are you?
I'm well, thanks. You look pretty in pink. How are you?
I'm good. Good. Just didn't quite have enough caffeine this morning, but I'll make up for it later.
Well, I'm celebrating 4 years without caffeine in December. I'm pretty excited. So.
Oh my gosh. I don't drink, I don't smoke, but don't take caffeine away from me. I would not be a very nice person.
I guess we all have something that we need, right?
I think we all should be allowed one vice, at least one.
Right. I agree with you. I won't tell if you won't. So.
Okay, good. Our secrets are safe.
CATHY, I'd love for you to share a little bit about the work that you do helping people with home health care, and also how you met our guests who are here today.
Well, so let's see. I do have my own home health care agency, and what we do is we provide caregivers for the seniors that want to age in place. Not everybody wants to sell their home and move to an assisted living facility. And so, I get that. And I wouldn't want to sell all of my things and that I'd acquired over the years and try to create a new life if I could, avoid that. So, we provide things like live-in care, hourly care. And this is really helpful for we have a lot of clients that their family doesn't necessarily live in the area. And so we are hired to basically oversee them, take care of them, basically manage their life for the family. And, just with the way that people are spread out all over the country, this has been very helpful. It takes the burden and the load off of a lot of families. And even so far as to, like, for example, yesterday we had to say goodbye to one of our clients. They had to be taken to the hospital. They had been with us for quite some time, and we had to say goodbye. Their life ended. And so, I had to notify the family, and it's just the way things go, right? But so, like I said, we will basically help manage your loved one for you and their life. Now, on to happier thoughts. With our guest today, I met them through, we have a mutual acquaintance, mutual friend, Mark McClatchy with Assured Dwelling, or is it Dwelling Assured? I always get that backwards. They're gonna clock me because they have. I just can't remember. Maybe it's due to lack of sleep. I don't know. But anyway, I had the great good fortune of connecting with them, and they're awesome. They have a great product, and I can't wait for us to bring them out so they can tell everyone.
Fantastic. Thank you so much, Kathy. And of course, we're sorry for the loss of that person that you and your team were taking good care of. And it just seems wrong that we can't just go on forever. But we want to make sure that while we're here, we get the health care that we need and that
Right.
we are empowered and in the driver's seat. So we are excited to welcome back two gentlemen who have partnered together, and what they're doing in the healthcare space is really revolutionary. So let us welcome first ASHOK KAPUR, CEO of Hawkeye MedTech, and welcome. Hello.
Good morning, both Kathy and Dr. Jacalyn. It's so great to be back on your show.
Morning.
Looking forward to a great conversation.
Thank you so much. We are as well. And we also want to welcome Aaron Westphal, Director of Sales at Kiosk Group. Hello, Aaron. Welcome.
Good morning, Dr. Jacalyn. Good morning, Kathy, and good to see you again, ASHOK.
Good to see you too, Aaron.
Nice to see you both as well. So before we get into the specifics, you were here not that long ago, maybe a month or 2 months ago, I can't remember, but some things have taken place since then that are super exciting. Why don't we start with that and then we'll work backwards? So who would like to go first? ASHOK?
Go ahead, ASHOK.
I'll go first. Thank you so much. It was so great being on your show earlier. And that's when we talked about our telehealth stations, the portable telehealth stations that bring healthcare closer to where people live and work. And since then, we have deployed these stations at multiple assisted living places, and also there is a active deployment going on at a Southern Maryland community center, and that is amazing because in that place, in that town in Southern Maryland, most of the people don't have internet access. And this community center is on Main Street, so which means people going back and forth have access to just stop in, get their healthcare taken care of by be able to manage your blood pressure, pulse oximetry, or others, and do video calls with the doctor and keep on going, maybe shopping or back home again.
Wow, that's exciting.
You know, when you said, ASHOK, that this community doesn't have internet, that really hit me right between the eyes because, okay, so how long has the internet been around? Over 20 years, right? You know, you would think that, and I just take this for granted, mistakenly, you would expect it to almost be like everybody has indoor plumbing, right? I mean,
I know. It is so strange, especially in a state like Maryland, which we call which is so close to DC, very progressive and very it's not the so-called rural state we talk about where there is access to road accesses and other impediments. On top of that, one of the interns is helping bring this into the community. This intern just graduated high school and went to college, and she said most of her community children have never seen a pediatrician. Can you imagine going all the way to high school and never seen a pediatrician?
Wow, absolutely not. That's frightening.
This is just 1 hour away from where I live in Montgomery County. It's not that far.
It's hard to comprehend.
It is.
Yeah, it's true. Just a quick digression. I'm here on an island in New Jersey, and maybe 5 miles away, there's a whole homeless community that I had no idea about. So I think the point is that there are people in need, and being able to bring services to them is key. Aaron, what's been going on with you since you were here last?
Definitely. So, I mean, ASHOK and I had a great conference. It was at MACO conference in Ocean City, Maryland. So it was always nice to be there. But we went there. We got to talk to a lot of great people from the state of Maryland that are reviewing our units. We got a lot of buzz from the VAs, right? So we're going to be putting a unit hopefully in there. We're looking at a lot of different urgent cares that need to stay open 24 hours, different places like that. So I'm the director of sales. I actually moved to the director of sales and operations now at Kiosk Group. So we're helping ASHOK build these, design these. We're coming out with a second rev of these, if you might say, so that way we can make some improvements for the community. So we've been doing a lot since the last time we spoke, I think late July.
Congratulations. Thanks for sharing that. I'd like to start off with people who didn't see the first interview, and you can go over to our YouTube channel, USA Global TV and Radio. What is the business issue that you're solving for?
The main business issue is lack of access to healthcare. Many people in the community do not have the access to healthcare. May it be they don't have enough time to take up from work because the paycheck is actually just enough to sustain them. The healthcare providers live too far away, or you don't have the healthcare providers open when you are ready and available. So there are a lot of impediments to access to healthcare. So what we do is with our Total Care telehealth platform, we bring access to healthcare on your mobile device. So you have access to entering your blood pressure on a regular basis and be able to seeing that graph and trends, blood pressure, temperature, blood glucose readings, blood oxygen saturation, and all the other vitals, so you can start self-managing your own chronic conditions. You can actually schedule video calls with your own healthcare provider. So now you can have continuity of care beyond in-person visits onto virtual care platforms. And if you don't have access to health internet, or you have issues getting onto the platform, you can put these telehealth stations that we designed in conjunction with the Kiosk Group, where these stations have a blood pressure machine built in, a pulse oximeter, and the telehealth platform right here, where you can actually get video calls with your doctor right there. So that's what we're doing at one of the VA centers in Maryland, and also this community center that we talked about, and several assisted and independent living facilities in and around Maryland.
Thank you. A question before we go to Kathy. So you realized there was a need, and then you were able to come together, the two of you, to provide a solution. What did that journey look like for the two of you to work together? I'll go with Aaron.
Sure, I'll take this one. So, I mean, ASHOK and I met about, I would say, a little over 12 months ago. This has been a year-long journey for us. ASHOK started his platform back, I think 2018, and correct me if I'm wrong, ASHOK, but we met through Kathy's mutual friend, Mark McClatchy, with Dwell Assured, and we really appreciate Mark for putting the two companies together. We're both partners with Dwell Assured in different aspects. And so what happened is that ASHOK came into my office, had an idea, kind of wrote it down on a piece of paper, and then we brought it to my engineering staff. We saw a need for this in the market as well. We see that this is one of the most highly SEO and Google search type of kiosks for telehealth medicine. And that's due to, 2020 COVID, not being able to see a doctor. You can use these as kiosks. You can now have the platform on your phone. So that journey came to us from that, to our engineering staff and my great engineers and my head of product development, Mike James. We created something. We brought it to ASHOK. We made some minor changes. We went to a couple different revs of this kiosk, and then we, brought it to market as soon as we had it all working. Now we're doing a test, I would say, in the market to see if there's any feedback, to see what we need to change, and then we'll just keep improving from there. So it's been quite a journey of two Maryland-based companies meeting with a third Maryland-based company, and then working all together to make that happen. And now I think we might bring in another Maryland-based company here soon to create the tablets actually that go into the kiosk itself.
Love this, especially hear stories like this that happen somewhere in a different country, and it's right here. I'm in New Jersey. You guys are right there. Kathy, you're in Virginia, so it's super exciting. Kathy, what questions do you have?
So, I mean, I'm just so impressed with this, and just particularly because of the line of work that I'm in as well, and so I'm always interested in what are when you introduce this to a potential new client, what are the no's? Because I look at it and I would just see people going, okay, yeah, we'll take 5, we'll take 20, and so I mean, I would just be interested as to, I mean, maybe that's the wrong kind of promotion, but I just can't imagine why anybody would say no. What kind of objections are you guys getting?
I'm glad all 4 of us are on the same page there. But the objection that habits are hard to break, and changing human behavior is a process that I think that takes. So when you introduce new technology, the first thing is, well, I was fine when I didn't have it. Why do I need this, right? And it takes time for people to get awareness that this actually helps you get access to healthcare. So let's talk about my mom, right? So she's close to me enough that she knows that their son created this technology that is amazing, and she talks about it. Mom, you are hypertensive. Are you using this? No. Why not? And it took her, a couple of times encouraging her to start using it. And now she raves about it all the time. Oh my God, it's so easy. I check my blood pressure every day and put it on the platform, and I can see how I'm doing over time. So I think it's just trying to get over the hump of trying something new. Once you do that, then you get used to it. And that's, I think, one of the reasons we created this telehealth station is when you tell seniors to download an app and use it, the first thing is, oh, it's technology. I don't like technology. I was doing fine with piece of paper and pen. Why do I need to use it? So when we created the stations, let's put them in the facility. So they come to a central place to use a platform where somebody can help them a little bit, get over the technology fear. And what we have seen is once that happens once or twice, they become self-sufficient and see how simple and easy it is to use. And now they can do it from home, and they don't need to come down to the facility as often and have somebody show them how to do it.
Definitely. I would also say, one of the $1 million questions that we always get asked, Kathy, is, and I'm going to shoot this back over to ASHOK to explain it, but who's paying for it? Right. So they're like, well, who's paying for the station? Who's paying for the platform? Right. We're not going to drop a huge amount of money, especially in some of these places like that don't have internet, or that, are underprivileged or don't have the means to, go with new technology because it's too expensive for them. So I'll let ASHOK explain our excellent platform that he created and how you do this and how you can get on Totalcare. But that being said, that's kind of a leading question for him, but it's a great knowledge base to know why you can use this, and everybody can. So go ahead, ASHOK. I'll let you take it.
Thanks, Aaron. So we have modeled this totally in line with how healthcare is delivered today. When you go to the doctor's office, your health insurance is billed for the service. Similarly, when you download this Totalcare application on your phone, on Android and iOS phone, you don't have to pay anything to download or use it. When you get on a video call with the healthcare provider, they will bill your healthcare insurance for the call. So use of the platform for people is no charge. Same thing with the stations. There is no charge for people to use the station, and to for the facility to have these stations. We have kept it so simple and easy. It is less than $2 a day for them to have this at the facility. So we made it so low entry point that nobody has an excuse as to this is too expensive. That's why we have been able to go to smaller assisted living facilities, or what they call group homes, be able to put these there because, oh, that's simple. I can afford that. And they see a huge benefit on it. This one facility that I went to and told them about this station, and they said, oh, if he had come a day before, we had a patient with high blood pressure. We had to take one of our staff off duty and drive them to a cardiologist. So that was a half-day visit for the patient to go to a cardiologist and be seen, which I believe could have been easily done on a video call with the provider. So you would have saved the payroll for this staff member to take them off duty and take them to a doctor, take the patient to the doctor's office, and the disruption that it caused for the patient. It's not monetized, but there is a huge monetary value can be assigned to their disruption and anxiety that was caused to the patient to having them driven to the cardiologist.
Thank you. I just want to clarify something for our audience. So is this solely for seniors, or can this go into corporations where you have employees who don't want to, they go and get their vitals checked?
Right. So I'm talking about seniors because this is a aging gracefully with things. No, this is for all general population. That's why the community center we're putting it on, there will be high schoolers that will be using this platform. So it is for all ages. It's for great new mothers who have, so many pediatric issues that they are just trying to get to know what the baby is all about, and, earaches and fevers and bumps on the skin and not sleeping enough, not eating enough, too much eating, too much sleeping, all that stuff that goes on. Pediatricians' phones ring 24/7. So this can be easily taken care of by getting on a video call, so the pediatrician can see the patient, they can hear from the mom or dad, and be able to take care of this without you having to go to pediatrician's office at all. So it's for all ages. And great, as you said, for corporations to put this in their building. So now employees don't have to take a day off to go get their checkup done and follow-ups done at doctor's office. They can do it from work, just go to a meeting room, use a televisit consult, and be able to come back. And we were also talking about some of the places like maybe police stations and fire stations, a lot of other places where our first responders are working so hard trying to keep us safe that they forget to take care of their own health and wellness. So if we put these at those facilities, these first responders, which are so valuable to our community safety, they can check their blood pressure and blood glucose and all that stuff and keep themselves healthy, so they can be good, productive services of the community, and also be a good members of their household.
Definitely.
I can see so many applications for this. I was just thinking, I don't know, cruise ships, airplanes, like there's so many applications. So one question I have for people who are thinking, okay, I've got my phone, I'm watching this, I want to download the app. What does the app look like?
So the app, so this is Totalcare app. I don't know if it's visible or not. And then you register yourself, sign on, and once you sign up, you can actually log on and then pick a healthcare provider to make a visit, or simply enter your temperature, blood pressure, respirations, pulse rate, blood glucose, weight, and your pulse oximetry and your mood on a regular basis, and be able to see all this stuff graphically. So now you can actually see how you're trending with your blood pressure, temperature, and all that stuff. So now you can manage your chronic conditions, and it's an app-based. You can download it on iOS phones, tablets, Android tablets, Android phones. You can even do it on the web. So it can be any platform that you can access internet with and be able to get to the application. And these stations are amazing because, as Aaron was saying, this is made in Maryland. So these stations are made in the USA. And have blood pressure machines. So you don't need to worry about not having a blood pressure machine handy. They have a pulse oximeter. So this way you can check your heart rate and your blood oxygen saturation levels, and we can add other devices to be able to check your blood glucose levels and everything else too.
Very exciting. Thank you so much.
So, ASHOK, maybe this is an inappropriate question, so I'm just going to ask it, and if it is, then just say that's it's we don't talk about this right now. I just wanted to preface that.
I'll mute her. It's okay.
Yeah, right. You got to be
right.
You never know what I'm going to ask. But so, what does one of the kiosks cost? Because you talked about that it has a great entry price point. Because I'm sitting here thinking, all the why not, but then I'm wondering what is inexpensive to one is not inexpensive to another. Sometimes that's pricing can be a relative.
Yes. So we have made it so simple. Right now, the introductory price for deployment, as Aaron was saying, we are test marketing it. We want to place about 20 of these before the end of the year and see how they use and be able to take the feedback and then do another huge deployment after that. So for that introductory rate is only $60 a month. That's it. $60 a month for this station that is ADA compliant. You can tilt it up and down. This has, has a tablet, has a blood pressure machine, pulse oximeter, all that stuff built in, and we take care of all the maintenance. So there is nothing to worry about. It's just that the price is going to go up next year after the deployment is done and we do a Rev 2 of it. It's going to go up a little bit, but $60 a month is, I think, a great price.
So then this should be in every household, right?
Right.
I mean, that's
what I was thinking.
I mean, why not? I mean, because you said you have the blood pressure monitor on there. It's the pulse monitor as well.
Yep, blood oxygen sensor, right? So you can test your O2 levels. We've learned that that's a very important, especially in the last couple of years, right? So.
Well, I mean, everybody's always looking for something to give people for Christmas that's different. I mean, why not? This is great, and it's a great price point.
Exactly.
You can't buy anything for $60 anymore.
Right, and you don't have to wait for the supply chain issues that most people are facing right now in the market, right? So we see it all the time. I've heard horror stories where people haven't gotten delivered a couch for a year because it's taken so long to get. So these are made at my shop, and it's a little town called Frederick, Maryland. It's in Western Maryland, about 45 minutes away from Baltimore, and we can ship these out in probably 7 to 10 business days to your company if you need it. So, and Kathy, when you were talking about use cases and corporations, and Dr. Jacalyn was, schools are a big one too. We focus so much on the blood pressure monitor, and we focus so much on the pulse oximeter and these things, but we also, we're looking at these for mental health places as well. It's a big deal if, police stations, first responders, they might need these to talk to somebody, right? Same thing with kids in school. If you're away for the first time, it can be a hard thing to do. So we also are looking at places like Hood College we're talking to, and local for the local side, and some other, big higher education places to put these in schools actually for that purpose. And because of what ASHOK would go through with the school nursing population has dwindled greatly due to pay over the last, I would say, 3 to 6 years. So we're looking at that also. So those are just another couple applications that we're using these for.
Yeah, I mean, I think really and truly this would be a great Christmas gift, great stocking stuffer. I mean, great birthday gifts. I mean, seriously, people are always looking for something different. Why not? Well, so how are you getting the word out there? How are you marketing this?
So we have a few salespeople out there that are promoting this to healthcare providers and to facilities. We are doing social media updates too, and glad to be on this platform so we can spread the word to the general community, and also with our website. So we have several channels going on. With Aaron being our partner with the Kiosk Group, they have several thousand deployments of their kiosks out in healthcare facilities and in senior communities and schools. So they are reaching out to the same population that bought their regular kiosk to see how they can add that to their current deployment and add these portable telehealth stations to the same facilities, like universities, colleges, high schools. We even had a great conversation with a correctional facility director at Mako, where we were at in Ocean City a couple of weeks ago. And he was telling me this is a great tool for non-incarcerated population that on supervised visits, when they come for supervised visits, they can also get that healthcare metrics checked. And this is also great for probably the immigrant population, especially the refugees coming over from different countries into the U.S. We can actually do health and wellness checkup and follow-ups for that population also.
Yeah. Don't forget about Starbucks. Just get one in every location and you
There
can
you go.
retire.
You got it.
That's right. But do it before you have your coffee hit.
Yeah.
Because after you have your coffee hit, your blood pressure is going to go up a little.
Yeah.
I just want to mention something also, that it's very difficult to get an appointment with a doctor. I know before I left Florida to come to New Jersey, they're like, oh, it's a 6-month wait. And you can't wait that long sometimes. So at least if you're monitoring things and something seems to be askew, you can actually contact the physician right there through your kiosk. It's amazing.
Absolutely. And, when you go to doctor's office, like when I go to my doctor's office, my doctor always tells me, Ashok, you have high blood pressure. You need to get on the medication. But I said, Doc, I check my blood pressure regularly at home. At home, it's normal. Just that when I'm coming to you, I'm running late from meetings, running to you, running through traffic. Yes, I do speed when I go to doctor's offices. Okay. So then if I do all that, I'm coming to you, I'm actually huffing and puffing, so my blood pressure is high. So with this platform, you can actually show the doctor how your blood pressure is trending when you're at home, and not just blood pressure, your blood sugar and all the other metrics too. So they can get a good picture of how you're doing outside the doctor's office and then be able to get you the right medication, the right dosage, based on evidence-based medicine, which is how you have been trending over time.
Super exciting. Thank you. Aaron, do you want to add something?
I mean, just that, the platform is great. I love that you can go from the phone to the kiosk. You can get daily vitals. Ashok can talk about more about, like, he's got a watch coming out, so that way you can have your daily vitals be checked on a watch that will connect with the platform, with the kiosk, so you don't have to worry about, oh, maybe I'm on my phone one day, maybe I have to go to a kiosk another day, maybe my mom is on my phone one day and then we took her to the community center and she's on a kiosk the next day. It's all intertwined with the software. So he did a great job at developing this software. Like I said, the software has been going on since before I ever even knew what telemedicine was. I didn't know what telemedicine was till 2020. Probably like 80% of the population didn't, right? So when I met Ashok, I thought that he had developed this through the pandemic that we faced, but no, he has been doing this for years. So he's been ahead of the game completely when it comes to the software and what works and what doesn't. And you can add notes and record things, make sure that the patient gets everything that they need, add pictures. And that's why we kind of developed this kiosk to do that same thing. So when Ashok told me that, I can go out, when you ask where we reaching out to, Kiosk Group has been fortunate enough to work with hundreds of urgent cares, hospital systems, higher education, all the way from places like Montclair University to St. Luke's Health Network, to some of the biggest hospitals in the nation. And so we get to push this great product to them. And I feel like it's, showing them that we can actually help them instead of just selling them something new, because it's actually something that everybody should have.
Well, congratulations to both of you. I'm excited about the wearable as well. And yes, okay. Let me
And read my mind. So here is the watch that actually checks your, yes, I'm wearing it backwards so I can show it to you. Temperature, heart rate, EKG, blood pressure, SpO2, and respirations all while wearing it. So I just click on this and it checks my blood pressure right on the fly. And when you're wearing it, we're going to integrate this into Totalcare, so you don't have to do anything. You don't have to put a cuff on. All you do is wear the watch on a regular basis, and it's going to check your blood pressure, temperature, SpO2, and all these other metrics, and regularly enter it into total. Oh, 119/78. Woohoo!
Woohoo! Nice.
Wait a minute. So how long have you had this watch in? Is it available now?
We are working right now. The watch is available now, but we are integrating into Totalcare, and that's going to be a couple of months down the road. Then we can deploy this watch along with Totalcare, and you can just wear the watch and do all that. Be able to have.
It will be available for the holidays.
Yes, we are trying to see if we can make it available for the holidays, and then you can just download Totalcare, get the watch, and boom, good to go.
Wow, another great stocking stuffer.
I love it.
Yes.
I already downloaded Totalcare, so I'm excited about that.
There you go.
Now, will the watch?
I had an argument with my spouse, she can say, "Ashok, check your blood pressure. Your blood pressure is high. Calm down."
Wow.
Now, will the watch be available on your website, or how are you going to distribute that?
Yes, it's going to be available on our website. And what we are also doing is partnering with other medical watch wearers like Garmin and other companies. So then you don't even have to just get our watch. You can, for example, get a Garmin watch and integrate and be able to have all your vitals being populated by Totalcare just by wearing a Garmin watch. And we're trying to integrate with other watchmakers also. But Garmin is our upcoming partner in Totalcare.
You read my mind.
People are going to be, they're going to look like superheroes. They're going to have their Apple watch on. They're going to have their Rolex, and then they're going to have their Garmin watch. I mean, it's just going to be like, super cuffs.
I say get rid of all the other watches. Just get one of these watches, Garmin, because it also tells you time.
Oh, wow.
Wow. Yeah. Imagine that.
Oh my God.
It tells you time.
Now, what do you think a price point will be for your watch?
My watch is going to be very, very reasonable. It's going to be somewhere around $100. So it's like, even cheaper than most of the healthcare watches out there.
Yeah.
Right.
That's amazing.
And the Garmin's are like, I own a Garmin because I'm a golfer, so I can see, where I can download an app and see the golf course on my watch now, and so I can actually get Totalcare on that watch that I'm playing golf with, so that way I don't get too high of blood pressure when I hit a bad shot, right? Because I know that I probably do. So the doctor might not want to see that, but those ones range, $299 or so, but they're great, and that's all it is integrating now with Garmin, so that way the software can be downloaded onto the watch just like the other apps that they have available. So it would be really great to have that. So that's
I am so behind the curve. I am so behind the curve because technology, I've made it abundantly clear. Everybody knows this about me. Technology is not my bag. I do good to get an email out. I can do a spreadsheet. I could, there are some things that I can do, but I feel like I'm very forward thinking in like design and fashion. And so those are things that really grab my attention. I am floored with, when you talk about technology. Okay, so I had no idea. I would have never thought, put this in a watch. Of course, put it on a watch. Okay, so Ashok, what is next? I mean, you seem to be, or Aaron, what's the next big thing that you see relative to this type of care and your products?
So imagine me just looking into the camera and it's checking my blood pressure, pulse rate, glucose, my glucometer, glaucoma number, and my mood. If I'm sad, depressed, anxious, all that stuff, just by looking into the camera.
Is that what's next?
That is what is next. We are working with a couple of technology companies to bring that onto Total Care in the probably near the end of next year.
Right.
Okay, so
Can
you're
you
scaring
imagine
me because you know what? You're going to be the one that comes out with the technology where if I'm in front of the camera, you'll be able to know exactly what I'm thinking. And that, I mean, you know, that could be good or that could be bad, right? I mean, oh my God.
I don't know. Mind
I'm
reading. Mind
serious.
reading is going to be
You
hard.
scare me.
Oh my gosh. As you know, I love technology. I shared that before, and I wear my unknown brand that doesn't do your blood pressure, by the way. But the whole reason I wear this watch is for my fitness. So I love the fact that yours is going to be connected to your kiosk, and that is genius. Christmas has come early, my friends.
Oh my gosh. Oh my gosh. That's amazing. I mean, it
So
really is.
it is. I want to pull up your websites quickly before we close out. So let me share my screen. And the first one that comes up is the Kiosk Group. So Aaron, you want to walk us through this, please?
Sure. So this is our website. It's been great. We've been doing active development for about 10 years on this website. So we used to be called iPadKiosk.com because we do a lot in iPad space. But now we've branched out like with ASHOK to Total Care platform is actually on the kiosk. It's on the Android platform. So we do Android, Windows, iOS. We have our own software. It's got over 1 million downloads. It's called Kiosk Pro. So any other kiosk project that you have minus Total Care, you can use that for. It's actually a back end to display any website content that you want. So whether it be in a museum or a check-in space or just to promote any brand in a partner's kind of office space or anything like that. So it does a whole ton of things. MDM software, we actually did a COVID screening solution with it called Checkpoint. So we've been in the healthcare space for a long time. So if you scroll down, you'll see like some of the different use cases we have. So in healthcare, you see a gentleman in a wheelchair sitting there. That's in a hallway. So we are big on ADA compliancy, and that's why ASHOK knows that our kiosk is ADA compliant. My owner actually sits on the board of Kiosk ADA compliancy. So we're really big into that in the American Disabilities Act. So actually that is a new project that we're working on that you can actually see somebody from, if you need to look at them, facial recognition software, anywhere from 7 foot tall to sitting down in a wheelchair. So that would move up and down on that platform right there. So that way it's easy to get a front facing view. What we catch is people with facial recognition, when it's in one spot, you might see their chin or you might see their forehead. I think ASHOK's got a funny story that I heard about his wife going to the airport, and he had to lift her up so that way they could take a picture of her because she's under 5 foot tall, so it only saw the top of her head. It was a great story when I was sitting with them and talking, but that's what happens, right? So that's why we developed this, is for people with disabilities. So we do everything from restaurant and food ordering, softwares and hardwares to your basic museum displays. So you can talk to an expert and you'll get one of my people. You can view our custom gallery like you see there, and we have all kinds of customizations that we've done. And then ASHOK's going to be on the platform soon on our healthcare solutions page. So with that being said, we have all kinds of healthcare solutions from ASHOK's to what you see with ADA, and also to Epic Welcome Check-in software is who one of our partners are, who does patient record keeping. So that's our everything in a nutshell. You can explore it. We have about 100 pages on there with different kiosks that you can buy right on the platform. So you can click on and you can see, go to standalone kiosk right there. If you scroll down, and you can see that these are ready for sale right now. If you scroll down a little bit, you will see
StreamYard makes you, every time you go to a different page, you have to reshare.
Oh, okay. I understand. Yeah, because we have 100 different pages because of how many different kiosks we sell. I think our variations of kiosks is in the millions because of how many different little things that we do. We do all of our own graphics, all of our own branding. So there's some of the kiosks right there that you can buy right online every single day. If you want something more customized than something like this, then you just call us and we'll work you through your project. And that's what ASHOK ended up doing, and saw our website, saw that we had the capabilities in our manufacturing facility. And then we went on to create something like you see there, which is greatly different than what you're seeing on the screen. So anytime you want to talk to us, just you hit talk to an expert button, and one of us will respond within 24 hours. So that being said, it's been a great thing to be a part of. And I never knew what a kiosk was 2 years ago. I thought it was a place that I got my cell phone fixed in the mall.
Same thing. That's what I thought as well.
Yep. And then I did this, and now I've met ASHOK, and we've just been doing great things in healthcare. So I'll let you go over to Hawkeye MedTech's website now.
All right, here we go.
Cool thing about Aaron's Kiosk Group is, if you saw some of the pictures of the standalone kiosks, it's not just the great station. They do different skins on it. They can graphically design skins, and instead of gray, you can put in logos of the companies and graphics. So it's more appealing, and it's not just a plain gray looking stand-up kiosk.
Thank you.
Thank you.
So Hawkeye MedTech. So this is our Totalcare telehealth platform. One thing that we haven't talked about in today's talk is privacy and security. Our platform is totally HIPAA compliant, which means all the communication from the station to the healthcare provider and also to our backend, it's all secure. So nobody else knows what information is being exchanged or the video that is going on between you and a healthcare provider, as opposed to many other times you have gone through a video call with your doctor, you use a regular Zoom, or you do just a regular video call using FaceTime or something. None of those are HIPAA compliant, which means your information is out there for somebody to steal and resell. And I don't know if many people knew this or not, but healthcare data in the secondary market or the black market is the most valuable data around. It's even more valuable than your user ID password for your bank accounts. People pay premium money, so there are a lot of people stealing in the healthcare information of you and reselling it. So our platform is totally secure that way. And your records are private to you unless you decide to share with somebody. So we have one facility that it allows you to bring a family member on the call, but you have to invite them to get on the platform. They cannot come in. So it's very secure that way. See if you can scroll down. Easy to use. And we have scrolled down some more. We have a lot of videos that we have created. If you go Totalcare for platform, when you go try it, we have a lot of videos talk about use cases, a busy mom at home, seniors living at home, person with COVID, mental health. So you can look at those videos and be able to get a good picture as to the benefits of using Totalcare. Scroll down some more, please. So some of the testimonials and a little about us. And if you go to the patient tab up top.
I just want to share one thing, that the app looks like this, the icons here.
Right. This is for the clinician. Right. This is how the Totalcare for patient looks like on the right-hand side. That's what you're going to download.
Okay. So we're going to go to patients, but I have to stop sharing and then come back. Okay. I'm back over here in StreamYard. Let me share again.
Scroll down. So it talks about how you can add photos, videos, you can manage your chronic conditions, you have appointment reminders that come to you so you don't forget that you made an appointment. It tells you that. And then if you scroll down, we have videos walking you through how to use Totalcare, how to download, sign up. If you scroll down some more, these are steps on how to download. It's a very, very easy instructions how to download them. We have some of the patient testimonials. When I say patient, somebody told me I'm not a patient. So please excuse the term patient because I cannot come up with a better word for it. All of us are patients, even doctors are patients. A patient is somebody who seeks medical care. patient is not that you have to be sick to be a patient. I'm a patient because I check my blood pressure on a regular basis.
Mm-hmm.
So please excuse the word patient, unless somebody comes with a better term. Stick with patient. So here are some of the videos we have and some of the documents we have to help you navigate the platform better. And if you can go to the clinicians, we can talk about healthcare providers, benefits to them. And so Totalcare is great for healthcare providers. I don't know if you knew or not, in the US, 80% of primary care providers say that they're working at capacity, and 75% of them say they're overwhelmed. So this Totalcare platform helps increase clinical efficiency by not having to bring all patients into the doctor's office and manage all those patients together. You can actually take time off in the morning and not have to rush to your office and fight rush hour, be able to take some of the calls in the morning and enjoy a cup of coffee for the first time. And then maybe take some of the calls in the evening, so you get much better work-life balance. There is this one healthcare provider I know, and this is, healthcare providers that are listening to it will relate to that. She learned how to hold her pee for 10 hours because she was so busy seeing patient to patient. She didn't even have time to go to the bathroom. And that to me is insane. I go to the bathroom multiple times a day.
I do too. I would never make it. Never.
10 hours, no way.
Wow, that's the record, I think. I just want to mention, it's so easy to sign up that I signed up while we were doing the show just to give it a whirl. So I'm signed up, ready to go, put in the rest of my information. And when I think about the last time I went to a doctor, I had new insurance. So I had to drive an hour to see this person, sit in a waiting room, to be taken to the small room, to have the vitals taken, to be taken to the other room, to wait. It took 4 hours that I don't have. So I just love everything about this.
Merry Christmas. You guys.
So we're actually at the end of our show, sadly. So I'm going to spotlight each of you. And if you can give your contact information and how people can reach out, that would be fabulous. We'll start with Aaron.
Sure, everybody. My name is Aaron Westphal. I'm the Director of Sales and Operations at Kiosk Group. You can email me anytime at awestphal@kioskgroup.com, which is right there on the screen. KIOSKGROUP.com. And anytime that you want to, please visit kioskgroup.com. You can just hit talk to an expert, and you will get one of me or my great sales team members to help you with anything that you need.
And Aaron, if you could please drop your email into the chat, that would be great. Thank you. And ASHOK.
ASHOK KAPUR, founder and CEO of Hawkeye MedTech. Reach me at AKAPUR, AKA as in Peter, UR, at Hawkeye MedTech, HAWKEYEMEDTECH.com. It's right there at the bottom of your screen. Or if you need to reach me by phone, 301-358-2338. You can reach me or my staff members that way. And looking forward to helping you get healthcare at your fingertips.
Thank you so much. Can you drop your phone number in the private chat as well?
Yes.
We want to make it so easy for people to get in touch with you. Thank you very much. All right, gentlemen, it's been an absolute pleasure. We are literally thrilled for you, especially this wearable. I can't wait for it. So please come back and tell us how things are going.
Will do. Thanks for having us, both of you. Kathy, Dr. Jacalyn, it was a pleasure.
Thank you so much. It was great being on your show, and appreciate you welcoming us back. And Aaron, it was great seeing you.
Great seeing you again, sir.
And also, we featured you in the newsletter last week, and we'll feature you in the newsletter this week. So for those of you who haven't subscribed, go over to usaglobaltv.com, subscribe. And the newsletter is called The Global Post Magazine. It comes out every Wednesday at 11 a.m. Eastern Time. So look for more information about these two wonderful gentlemen in our next edition next week. All right. Thank you very much, Aaron and ASHOK. We'll see you again soon.
Thank you. Have a great day.
Bye. Thank you.
Bye.
Bye. Kathy, it's so exciting to be at the cutting edge of the information about what they're doing, isn't it?
Yeah, it is. But I'm telling you, these guys are scary smart. And I know that they're going to be the first ones on the market to put out the technology where, I mean, if you're like on your phone or whatever, there'll be like a little, a comic strip blurb again that's
like a cloud.
That says, something like, I'm just, I'm just not into you. I'm not into this conversation. I mean, I know it's coming.
Well, I would love to have you share your contact information, how people can get in touch with you as well.
Oh, sure. So if you need any kind of home care assistance, please feel free to go to my website. It's stayathomecareva.com, or you can feel free to give me a call. I'm at 703-402-1172. So I'd love to hear from you.
All right. Thank you, Kathy. Great show as always. And we're going to go off to our next show, which is What's Trending. So Kathy and I will see you shortly, literally in less than 5 minutes. And our guest today is Tracy Cram-Perkins. We're looking forward to welcoming her back. Thanks, everybody. Thanks, Aaron. Thanks, ASHOK. Thanks, Kathy.
Thank you. Bye.
Bye.